friends. I'm gonna not do video for this one because I wanted to snuggle my dog while I'm talking about this little guy, Gravy, and the Zoom angle is not forgiving. So you can not have to watch my face and get distracted potentially. But anyway, we've gone through a lot of content on different behavioral patterns that you guys are likely to see in two-star dogs. And I wanted to take a little bit of time to talk about how all of this stuff can come together to support an individual animal. And Gravy is a really good example of that. I'm going to talk through a presentation that I did for a grad school assignment last semester. And because of that, I just want to give a couple of heads ups. One, the slides are a bit more technical and a little more academic than I might normally do for talking through volunteer and staff trainings, but this was originally done for a different purpose. So I will sort of like unpack pieces throughout. The other thing I wanted to just introduce you to before we dive in is this concept of a multi-domain welfare intervention. So when I'm talking about multiple domains, I'm talking about work done by David Mellor and colleagues starting in the late 90s, but I think the most recent iteration of the five domain framework for assessing welfare came out in like 2020. And a big part of the graduate school project that I was working on for this assignment was assessing welfare using all five of Mellor's domains. So domain one is nutrition. Domain two is environment. Domain three is medical. I really should have looked this up before I started recording. Domain three is like medical, physical health. Domain four is behavioral interactions. And then all of those things contribute to domain five, which is mental well-being. So the idea is that all of our inputs, all of our supports that we give an animal, if it's touching all of those domains, we can support them at a holistic level. So as we go through the slides, we'll see if I remembered the correct order of the domains, and that'll be fun. But again, this is an optional talk. It just so that you can kind of see how all of the things that we've gone over for all the different kinds of behaviors and stems, like emotional stems that those behaviors come from, how we can work together and put all these pieces together for a little guy like Gravy. And Gravy was definitely a special boy. Starting at the beginning, I met Gravy on May 12th, 2025. Interestingly, this was about a week into me starting my job at Monadnock Humane. So Gravy was an early friend for me, and we ended up spending a lot of time together. But he was found as a stray. He was running at large with three other dogs that we believe were related to him, potentially his mom, and then a brother and sister. When he came in, he was visibly okay, a little bit thin, and he had some healing on his healed scarring on his face and body. So these were superficial scars. They looked like maybe from like little tussles, but we really don't know. We don't know what was going on with them. We had no home history. And on intake, he was the most fearful of the bunch. Not to a point that he was fully shut down, but he had the most trouble with new stuff. Early on in his care, he would like pancake on the ground when you put a leash on him. He was very, very fearful and overwhelmed. So Gravy, his first stint at the shelter was about a month long, and very quickly he bounced back from that initial fear period. And this was a point where we really weren't doing much for him besides our some kind of standard interventions that we offer to all dogs. And then who's if somebody is suffering and needs more help, then we start to adjust and add. But he was eating, drinking, peeing, and pooping normally. His fear, anxiety, stress, and frustration levels were consistently low. So, we neutered him in care, assessed him, got him medically healthy, and he was adopted on June 14th. So he spent about a month in that home. I forgot this picture is so funny. Um, Side note for this project, I realized I didn't have a lot of photos of Gravy, and I asked my teammates to send me photos, and I was just like, ugly crying looking at all these photos that all my friends sent me of this ridiculous dog. But anyway, he came back to us July 12th after about a month in that first home. No fault of his own, no behavior concerns reported. There were some housing issues that came up, and the person was unfortunately not able to keep him. So he continued to maintain, more or less the behavior we saw the first time. He didn't have that fearful setback. He came in at like his July baseline was like about how he was when he left the shelter the first time. So we didn't see any kind of regression. Some spikes of some mouthing stuff, but like pretty easy to handle up until end of July when he was spending time with a volunteer and delivered multiple bites to that volunteer. And you'll see on the slide, I've written the words provoked Dunbar level 3. So provoked does not necessarily mean what we think it means in colloquial English. I'm not saying that the volunteer like yelled at him or like hit him or anything like that. What I'm saying here is that the bite was there was a clear trigger. So it didn't come out of nowhere, even though the volunteer wasn't doing anything, they weren't trying to do anything to upset Gravy or make him angry, anything like that. When we unpacked what happened in that situation, there was a clear kind of choice consequence connection to what was going on with what the volunteer was doing and what caused Gravy to bite. So when you hear me talk about provoked versus unprovoked bites, that's really what I'm talking about. Was the bite predictable or not? And then Dunbar levels are it's a scale score that pretty much most all shelters use. There are a couple of other scales out there, but the Dunbar scale is kind of the most obvious and commonly understood one. Shelters use this to assess intensity of bites when dogs bite people or other dogs. And I mean, really outside of shelters too. Like you'll see behavior consultants use this as well in private client work. But a Dunbar bar level 3 bite means that he put teeth on skin, and that he broke skin with his teeth. So not necessarily a serious bite, like the person did not need to go to the hospital or anything like that, but he did draw blood from the person. So with all that information in mind, Gravy wrote out a 10-day quarantine. I worked with him a little bit here and there. This session is not the first time I worked with him um, after the bite, but it is the first time I filmed a session. So I'm just going to show you a little glimpse of it so we can see what his baseline behaviors looked like at this point before we really started adding additional intervention for him. There's a lot going on in that video, yeah. Here, I'm gonna just play a little bit so that it freezes on the scene because I'd like to point out a couple of things. So first of all, I have set up this room so that Gravy has lots of choices that he can make that do not include jumping on me. However, we don't see him really interact with stuff. He does go to the snuffle mat near the end, and that's after a really long time of him kind of like working out his feelings, right? I also had a good feeling that this session might go south, so I went ahead and set up I call this a little Juliet balcony. We're in the community room, and I've got the X pens that are used for puppy play school kind of around in a circle. So you see it at that one point in the video where I go behind this. So I have this little physical barrier where he can't jump on me, and we can work together. We can continue to train that way until he is able to regulate on his own. Um, you also can see, I mean, the video quality is not awesome, but there's no aggression here. He doesn't know what to do with his body. He's all over the place. He really wants to interact and doesn't seem to know how to. But you can also see how, like I've been doing this for a while. I like to think I'm okay at it. And I'm a professional, so you can see like the way that I interact with him helps to make this a learning session, an info gathering session, and not a dangerous safety situation. It could go south very easily if someone else were working with Gravy when he's in this state. So, here's some academic stuff, but an ethogram, this is a quick ethogram of Gravy's observed behaviors in this video. What an ethogram is, a list. It can be just lists. I kind of like it in graph form. Or table form. It's easier for me to conceptualize it, but it's essentially all of the behaviors that we see an animal do, um, categorized by the function of those behaviors. And before I got into school, I kind of thought like, oh, like there's a dog ethogram, and there are all of the things that a dog does are in that ethogram. And like that does, for some species, that does exist. I haven't really found a good, like, comprehensive one for dogs. But what you find more often is an ethogram for behaviors that indicate pain, or an ethogram for behaviors that indicate fearfulness. So it's a little bit more contextual. And what I ended up doing for Gravy to kind of assess these videos and really get a sense of what was going on is create an ethogram for him that's based on the research. So that the all of these behaviors that you see listed, the function that I have them listed under points to academic research that's cited at the bottom of the page. With a small caveat that I spent 6 months working with Gravy, and he is an individual. So, like, yes, he's a dog, but there are also, like all of us, there are idiosyncrasies that we all do that are maybe like not exactly species typical. So a couple of these things, and I apologize, I thought I had asterisked the pieces that are kind of like Gravy specific. But a couple of these things are not necessarily supported in the research, but are observed by me in the time that I spent with Gravy, as like I'm pretty sure that this is actually what he means when he's doing this thing. So for instance, like you'll see that like he might have his body forward in some context, and that might be a distance increase request. So when we talked about body language way back, when you were starting to look at one-star dogs, a distance increase request is like I'm doing something with my body to communicate to you that I want you to stop coming closer to me or to move away. Um, However, Gravy, in some contexts, will shift his body weight towards something, and it's actually a distance decrease request. And what I found with him is if he is weight forward with his spine kind of like stick straight and he's facing you, that is a distance increase request. If his weight is shifted forward, but there's no spinal alignment, he's got a nice loose curve to his spine. And this is really funny. I'm like talking with my hands, even though I don't have video on, but here we are. If his spine is curved and maybe his weight is shifted forward to you, but it's not necessarily like his face is looking at you, that in Gravy speak tends to be a request to come closer. So there's these little idiosyncrasies, but overall, this is a rigorous research-based ethogram. So anyway, based on that video, I categorized every behavior that I could observe in that 90-second video. And then what I did was essentially go back and watch that video in 4-second blocks. So on the bottom here, we see 0 to 4 seconds, 15 to 19 seconds, 25 to 29 seconds, etc. So for each 4-second block, I wrote down every single behavior in the ethogram that I could spot, and then I graphed them based on whether each behavior that I could count was decreasing arousal, indicative of increasing arousal, indicative of an increased request, indicative of a distance decreased request, and then counted those behaviors. So on the x-axis here, we see the time blocks. On the y-axis here, this is the count of behaviors that I could count. So I think it would be really interesting if I had time and money to like have a bunch of people also code this video to see like if we kind of get the same results, because it's just this is one observer and I'm not perfect, and I counted what I saw. But what's kind of cool here is you can see like, so this yellow line is distance increase requests. The red line indicates increased arousal. And these two kind of track together. Essentially, throughout the video, when he is asking for space, his arousal is also increasing. Similar to the green and blue line. So the green line is a distance decrease or maintain request. The blue line is behaviors that are indicative of decreasing arousal. So throughout the video, again, when he is asking for me to come closer or wants me to stay with him, his arousal level is also on the decrease. That said, there's also just a lot going on in this video. And I think one thing that's really interesting is in each time block, there are multiple behaviors with conflicting function, indicating to me kind of what we talked about, just like observing the video, that like he doesn't really know what he wants, you know? He's not sure what to do with his body or how to communicate at this time. It should also be said that this is a really like busy 93 seconds. All told, I coded 249 coded behaviors in 93 seconds. That's almost 3 behavioral choices per second on Gravy's part. And if you like, that's just a lot, especially when you see that they also tend to conflict in function. So then this was another piece that was specific to the project that I did for school. But what I did was look at Gravy's current state of affairs, like essentially, like what does he currently have going on for him, both in that video and also just in the shelter in his life in general. And I listed inputs for him. So like these are the things that we're already doing for him, that are already happening for him every day, and looked at how they fall in terms of whether or not they're having a positive or a negative impact across different domains. So again, domain 1 is nutrition. Domain 2 is his physical environment. Domain 3 is his medical health. Domain 4 is behaviors, and specifically behavioral interactions too. So not just what he does in a vacuum, but what he does with people, what he does with other dogs, those sorts of things. So a couple of things, he has access to food and clean water. He has access to appropriate foraging things. And as we know from other learnings through MHS trainings, foraging can be really, really useful. And we like to be able to offer those options whenever we can. Um, in the negative state, his food is not always available as quickly as he needs it to be to manage his frustration. And we see that in that video. We also um, anecdotally can infer that from the bite incident that happened. I won't go into the bite piece too much, but I think that that was playing a role, that he was getting frustrated. In the environment side, he's got clean space, he's got a comfy bed, he has access to the outdoors. One negative that I noted, and I honestly, I wish I had noticed this at the time that I was doing the intervention. It's really only in hindsight after watching the video that I realized that floor in the community room is really not doing him any favors. He doesn't have traction. It seems like it's freaking him out. So, I mean, that's honestly just a plug for videoing your sessions, because you notice stuff that you don't notice when you're in the moment. Not in the community room, but in the specific instance where he bit the volunteer, he was in a small space and had limited options to be able to move away. In terms of medical health, he's healthy. Our vet team had assessed him and found no concerns. One negative piece that I listed just to kind of be thorough was in watching that video, watching the way he manipulated his body around the floor. I do think he might have had something going on with his joints, potentially in his hind legs, but we were never able to diagnose that. And then in domain four, we see, Gravy is able to perform behaviors that he's learned. He can move freely in that space. He has lots of options for contacting reinforcement is a fancy academic way of saying getting snacks. And he has access to enrichment that is targeted to facilitate a decrease in that elevated respiratory rate, those jumpy, mouthy behaviors. The negative thing is that, like, I don't know what it is. Like, it's some confluence of factors, but something is going on for him that is making it really difficult for him to communicate his needs to people. And we don't necessarily have to know what that thing is, but something is happening for him right now where he is not able to behave in an appropriate and safe way. We've listed these inputs, we've talked through them. Some outputs that we can list that are showing us whether or not these inputs are helping or hurting. For example, like nutrition, we know that his food is nutritious because he's doing well like physiologically, right? Like we're not seeing too many issues with him. He did have some skin issues that we treated over time, but he was having, normal poops. He ended up getting a little bit overweight when he first came in. He was very thin, but he's putting on weight. Um, so those pieces are good. And again, like he has access to stuff to do to forage, but one of the issues that we're seeing is that he doesn't seem to like know that he can forage and he may not have enough opportunity. So that's an area where we can increase for him and potentially provide some additional support that might help him to get those big feelings out. In domain two, we've noticed that he's resting and sleeping. He appears to be sleeping multiple times throughout the day, which is appropriate for canines. He is also sleeping through the night, from what we can tell. He does engage in foraging. He sniffs when he's outside. His body language reflects like an appropriate level of arousal. However, he's got pretty limited access to the outdoors, right? He can only go outside when a person is able to take him. Um, in that particular video, he's struggling to gain traction, and that seems to escalating in arousal and potentially a medical issue. And he's also, he's showing us that he's got conflicting behaviors. He's got conflicting feelings about people, and he's not sure how to engage. In the medical side of things, he's accepted medical handling very well. That was one great piece about Gravy was that he actually like he loved the vet team. He was a great little guy in the vet. And despite being a little overweight, he's generally, in good health and all kinds of observable indicators. Then for domain four, this is the behavior piece. So he is able to respond to known cues when he's at a manageable arousal level, but it's hard for him to stay at an arousal level where he can learn. Essentially, like his body goes into fight or flight and he can't think. He can't pull from that working memory. Um, he has full range of motion. He's got plenty of space to move around. He has options for reinforcement. Again, he doesn't understand at this time where and how to access food on the ground. So that's going to be an opportunity for teaching him a skill that comes a little bit later. And despite a lot of support, he's still exhibiting these potentially dangerous behaviors. In that video alone, he delivers several Dunbar level 1 and 2 bites. So we talked about level three. Level three means teeth touch skin and make you bleed. They break skin. Dunbar level 1 is simply an air snap where the dog bites kind of in your direction but doesn't actually make contact. A Dunbar level 2 bite is a bite that touches skin but does not break skin. So overall, when we put all of these things together, domains 1 through 4, we see, fairly poor welfare in domain 5. We're doing everything we can for him, but he's still really struggling. So some of the things I did was first look at the things that can just be removed. So we started to limit community room time, at least options where he could get hyped up in that space. I'm saying I adjusted sh rules for volunteers interacting with him so that he was not spending time in a tiny space with other people whenever possible. So we eliminated those things. These pieces in the circles are pieces that we decided to get curious about, right? So how can we support him with an appropriate rate of reinforcement? What are other things I can add to the space to be able to support him? And we get a little curious about those potential pain points medically What are the behaviors that he's learned, and can we get to a place where he can perform them more often, where his arousal level is not so high all the time? And can we get more curious about what's going on for him that is triggering these responses? And then these are all pieces that are going great. So we kept these things and increased them if possible. So then comes the intervention, and a lot of stuff went into this. I think technically he might have already started on a psychopharmaceutical before that video, but kind of for ease of like explaining, we did a 5-point intervention that targeted all of the domains. So using medication in coordination with the shelter vet. I won't go into details for that. There's more details in the paper that I wrote on this, but there's some reason to believe that a certain type of anxiolytic might have been more appropriate. We ended up going with another one because of the practicalities of shelter life, etc. But anyway, so he started meds, um, enrichment sessions, training sessions that are based in ethical and humane and modern approaches to handling animals. Started helping him interact with dogs. This might seem like a little bit out of left field because it hasn't really come up so far, but basically, I wanted to see for adoptability, like can he live safely with another dog? Because so many of our adoptive families have other dogs. I wanted to see if dog time might help with arousal levels overall. And I also just wanted to see like, are you able to communicate with somebody who's your own species? Tightened some of the parameters for how volunteers were allowed to interact with him, both for safety and for making sure that he was getting kind of consistent interactions with humans, and some breaks from the shelter. So we know from some semi-recent research that foster interventions under specific conditions can be really, really useful for lowering cortisol levels and helping in general with anxiety. So the psychopharmaceutical piece, I'll breeze through this because it's not particularly useful um, levels of detail, but all all done, we decided to go on a gabapentin and trazodone trial. And what was really great about this is these two medications are onboarded quickly and they leave the system quickly. And gabapentin in particular also has a corresponding pain management factor. So if he was struggling with any kind of joint pain, that may have played a role in improving his behavioral responses overall. I don't know. We were actually never able to determine if he was indeed feeling any kind of joint pain. Training sessions were set up kind of similarly to that first session, but just with a couple of tweaks to kind of help him. So all the choices that he had available to him during training sessions were essentially choices that I was happy with him making. That way he had as many choices as possible. He got to make all kinds of decisions, and he got rewarded for making all kinds of good boy decisions. The rate of reinforcement stayed as high as humanly possible to manage his frustration while he was kind of learning and onboarding new skills. And that meant that food came not only from me, but from lots of preset stuff. So foraging mats, puzzles, boxes, all kinds of things. And we also worked a little bit with him on an environmental cue for relaxation. I did some work with him with a blanket that we would practice relaxation behaviors on. And that didn't end up being a huge part of his overall care, but it was helpful just in kind of teaching him how to amp down. So this is a video that was taken a little bit later, a few months later, and after a couple of breaks from the shelter, which we'll get to. It's a little bit out of sync. But this is him walking from his kennel to the outdoors. Let's see if it's set. So he can just walk from one cat to the next. Slows him down. You can see how soft his body language is. He's just a little not impacted by the barking. He's able to walk at a reasonable pace. And it's also safer for him because these floors were slippy too. So having him be able to slow down was very useful. Quick example of dog-dog interactions here. This is a really, really short clip. This is one that we did with Bella, who is an incredibly savvy dog. And what we see here is he very clearly communicates his body language. So he's actually, he's not having a terrible time, but he's actually asking her to give him some space. And the way we managed that was anytime he asked for space, we gave him that space. So he started to learn that his communication signals had had an effect. They mattered. If somebody is doing something that makes him uncomfortable and he asks them to stop, that interaction stops. And we started to do that with dogs, because he communicated so clearly with her and he was lower arousal, overall kind of less busy with her. And then we were able to, I don't know if this is actually what happened to him, but my theory is that that helped him to realize that he could also make those requests of people and have them be respected. So with our volunteer interactions, I and this was early in my tenure at MHS, so we've still like our volunteer program is still kind of iterating and always will be, but for a time Gravy was limited to only mentors, and I think at a certain point we opened him back up to two-star volunteers, but balancing the skill level needed for volunteers to safely handle Gravy and these skills that could reasonably be expected of Gravy to make good choices was such that I had him working only with mentors with some kind of specific parameters for a little while. So he could do free time, which was like sessions where a leash was on him the whole time, but he was in an enriched space like Fenway Park with lots of stuff to do. And he could do sniffy walks where Gravy led the walk and they went on the trails and kind of, if he wanted to come back at any point, we came back. And then we established some kind of consent rules for touching. So Gravy could learn to walk away when he was uncomfortable with a touch. And you've already seen a lot of examples, but this is actually me working with him. I don't have a video of a volunteer, unfortunately. These are just like, he's outside, he's got stuff to do. He's able to interact with a person, and then that's actually his relax mat that we were working with. Um, so he can go do calm boy stuff over there. All right, and then shelter breaks. So Gravy actually came home with me. He came home with me for about a week. He slept in a real bed. He interacted with my dog. And for a few of those days, he came back to work with me during the day, and we saw no real observable increase in stress, which is consistent with the available research. Um, it's interesting when I brought him back to work with me each day, I thought that he would want to be in my office during the day, but he actually wanted to go back to his kennel. So during the day, he would hang out in his kennel, volunteers would work with him, but he'd just kind of like snooze during the day and then come home with me. And that worked out really well. After that, we had an adopter come forward. So we're now in late September. This is an adopter who, on paper, I would not have thought was the right fit for Gravy. And I'm super grateful that MHS practices open adoptions, which means that we are focused on finding supports for people that might not fit the quote unquote ideal mold for adopters. There are many ways to love an animal. There are many ways to support an animal. And I strongly believe that being a homeowner with a 6-foot fence is not a requirement for owning and loving and taking care of an animal. So through some adoption counseling and having this, I almost called him a kid. He is a kid. He was a young guy. But having this sweet kid meet Gravy, he adopted him. Everything was wonderful. Gravy was gone for about 6 weeks. Unfortunately, this adopter had a pretty major traumatic life change, and no behavioral issues were reported, but Gravy did have to come back to the shelter. After that second shelter break, we did see some of minimal but observable increases in fear, anxiety, and stress. But we didn't need to really tweak the original plan that we'd been working on with him, that intervention plan. So it kind of mostly stayed the same for him once he came back to the shelter. And then in November, he was adopted. So this is, let's see, he came back on November 11th. He was adopted 2 weeks later to a multi-generation, multi-dog household. including kiddos, like young kids. And again, this isn't something I would have necessarily thought would be a great fit for him given his jumpy mouthiness, but he has done so much good work, and the kiddos were really wonderful in like listening and watching his body language and not touching him too much and knowing when to give him a break, that it was just a really beautiful fit. And I'm recording this on June 14th. And as of today, June 14th, 2026, as of today, Gravy is still in this home. So that's not to say it'll be forever. He could come back tomorrow, who knows? And then we would just pick up where we left off. But for now, he is in a happy home and I miss him every day. So just to kind of close out so we can compare that initial session, that 93-second video I showed you closer to the beginning, this is a session that was taken 6 days before he was adopted. And it's set up very similarly to that first session, but we're gonna watch it. It is outside, but otherwise you'll see like, he's got stuff to do in this session. So this is just about a minute long. And actually, before I play it, this video has captions in it. You'll see captions pop up throughout. This is because this was a video that I filmed to support volunteers in working with Gravy. When I went back to do this assignment, I could not find the original raw video. I think I deleted it off my phone. So I wasn't able to just like show you that without the captions, but try not to let the captions distract you too much. I am sorry about that. Some pretty obvious differences, I think, in that video compared to the first one. Let's review Gravy's ethogram again. So this is the ethogram that we used to evaluate his first video, and we're going to use the same ethogram to look at his behavioral choices in the second video. Again, just like the first one, we've got on the x-axis 4-second time blocks, and on the y-axis we have behaviors counted, so number of behaviors counted in each 4-second time block. The lines are the same. Blue is decreased arousal, red is increased arousal, yellow is a distance increase request, green is a distance decrease request. So once again, we see a kind of, it's a little bit less connected, but the blue and green lines kind of track together. Like if you zoom out, you can kind of tell like decreased arousal and distance decrease slash maintenance request are together. The red and yellow lines are also together. So we have that still. We have that trend with him still. When he has an increase in arousal, he's usually also asking for space. And then when he's decreased in arousal, he's calming down, is when he usually also wants to be touched or have you be close to him. The other thing is like just in terms of count, like far fewer increased arousal behaviors, far fewer distance increase requests in this video compared to the first one. This is also notably a much less busy video. 104 coded behaviors total in a 60-second clip. That's about 1.7 behaviors per second. And if you remember from the first video, it was like 2.7 or something like that. So almost a full behavior down per second. Importantly, behavioral diversity is maintained. This is a academic way of saying that he's still doing lots of stuff. Like I haven't just kind of like scared him to the point that he just stands there because he's not sure what he's allowed to do. He's still doing all kinds of dog things. He's just not hurting me and he's not hurting himself. So behavioral diversity is a really strong indicator of good welfare. If you're seeing an animal do lots of different species typical things, as opposed to an animal who's just kind of like sitting there and not really engaging with their environment. So I'm particularly proud of this video because we got him to a point where he's maintaining a lower level of arousal. He's not quite so erratic, but he's still maintaining behavioral diversity. And then post-intervention, um, we've got the domains here. So again, domain 1 is nutrition, domain 2 is environment, domain 3 is medical, domain 4 is behavior and behavior interactions. From beginning to end, we've been able to eliminate a lot of those negative inputs, right? He no longer has to deal with the slippies. He no longer has access to volunteers where he's in a space where he can't move away. In addition, we've got pain management, psychopharmaceutical intervention in place. And we've also, in domain 4, we've added that he's got access to healthy conspecific interactions. We still have this negative input that like he can only really access everything when he has a person available to facilitate these opportunities for him, but that's sort of like shelter life. It's a little bit difficult to mitigate that piece. So just to go over it again, we've eliminated these issues, right? He no longer lacks opportunities for foraging. We've able to achieve a rate of reinforcement that helps manage his frustration. From pre to post intervention, we've eliminated that risk of injury. We've seen fewer conflicting behaviors. He's more able to clearly communicate what he needs. This piece kind of stayed the same, but that's okay. And then in the behavior domain, domain 4, we don't see any bites in that video. He's able to understand where and how and when he can access food. And the arrangements of that space help him to actually amp down. So overall, we've done a measurable improvement in domain 5, which is that mental well-being domain. And then final takeaways for this is that, very little like training has been done. Some of my colleagues refer to this as capital T training, and that's where you're teaching an animal like a discrete behavior and you do it a bunch of times, and then like the expectation is like they perform that behavior every time you say that specific word. So like teaching a dog to sit or whatever. There's value in that for sure. This intervention had almost none of that kind of training. It was very much based in helping Gravy learn how to regulate on his own. Antecedent arrangement, which is an academic way of saying like how you set up your space, was like 90% of how we handled Gravy and how we got him to a successful outcome. And then the other piece that I want to be really honest about, because we've already had some tough conversations about behavioral euthanasia, is that like if one or two things had been a little bit different in Gravy's case, he may not have been an adoption candidate. And some of those things are, if his biting behaviors were unpredictable, if we were seeing aggression, honestly, it's tough, but if he were a bigger dog, that might have impacted our ability to adopt him safely into the community. If we had had more dogs in the building at that time, a lot of things came together that allowed us to have the appropriate capacity for care to be able to support a really specific and idiosyncratic dog like Gravy. And then N=1 is kind of academic slang for like this combination of stuff worked for this dog. The next jumpy mouthy dog that comes up is not going to need this specific plan. They're going to need their own thing that is tailored for them. So N=1 is kind of like we've got a study of one dog. We've met one dog. We've helped one dog. That doesn't necessarily mean that everything we learned here is going to apply perfectly to the next dog. We'll certainly be able to take lessons from it, but each dog is an individual and they're going to have their own little quirks that we need to address one-on-one. And then this is just a video of him being cute. This is when he was at my house. There's like a piece of kibble that he's just like really excited about. And you can just see at his core, he was just a lovely, happy little guy. I have academic references on the next slide, but I also think it's important to call out folks who've like taught you specifically and one-on-one and face-to-face. And I've had the benefit of a lot of really great mentorship in my life. And then all of our academic references are here. So if you're interested in reading up on any of this stuff, get in touch with me for sure. I'd be happy to help you get copies of any of these papers or books.